Good evening, everyone. I'm Leah MACADEN, Senior Lecturer in Nursing at the University of the Highlands and Islands in Scotland. I'm pleased to present my project on COVID-19 dementia education for care homes, CODECH for short, that I led as a Churchill Fellow last year. CODECH was funded by the COVID-19 Action Fund of the Churchill Fellowship. It is a comprehensive blended learning resource to promote dementia care excellence in care homes. We're all familiar with the disproportionate impact that the COVID-19 pandemic had on care homes in particular across the world, and the UK was no exception to that. There is increasing evidence that education and training to increase staff knowledge for their specific roles can potentially reduce staff susceptibility to burnout. And there is also an increasing demand for person-centered individual needs-based care associated with reflective learning rather than a task and time-focused training. I have the experience of developing innovative dementia curricula for undergraduate nursing in Scotland across 2 Scottish universities and successfully integrating them and seeing the benefits of students embracing this with passion. So I wanted to adopt a similar approach to support care home staff during the pandemic. CODECH also sits within the policy context in Scotland. As you can see from the slide, it directly addresses one of the rights within the Charter of Rights for people living with dementia and their families. So the overall aim was to develop a comprehensive resource for blended learning for the first time to support staff working in care homes, mapped along the stages of the dementia journey. So to scope and source materials and identify dementia care training priorities through consultation. An expert group was set up with 16 experts to develop the resource. We created 3 workbooks with expertise from instructional designers and education technologists. And we delivered the training virtually for 27 care home staff, actually, using a blended approach. So the 3 workbooks were based on the stages of the dementia journey and using Barbara's story as well as the narrative, and built on the pedagogical principle of constructivism. So the workbooks covered dementia care essentials, dementia care priorities, and dementia care enablers, as you would see here. And there's a sample of the workbook with a link there if you're interested to find out more details of the content. So what are some of the highlights of CODECH? This involved networking of Churchill Fellows with dementia expertise, including a fellow with lived experience of dementia and sensory impairment. This was particularly important because quite often cognitive and sensory impairments tend to coexist in older adults, as we know. The training covered the entire dementia journey, including prevention of dementia and brain health. We used a blended approach. The synchronous sessions were delivered over 5 weeks, over 20 hours, and the asynchronous sessions were supported with the 3 innovative workbooks. The workbooks supported self-directed or peer-supported learning, either as individuals or groups, and there were several opportunities embedded throughout the workbooks for reflective learning, and participants could either record their reflections as text or audio. Participants could also download bite-sized sections of the workbooks in a PDF format. The feedback on CODECH has been tremendously positive, as you can see from the slide here. And we didn't want the training to just end with delivering these sessions, so we requested staff and participants who were involved in the training to make a pledge or commitment. And as you can see from the slide, it was a really reassuring and encouraging and rewarding to see the promises that the participants made and also identified areas of dementia care excellence that they would want to lead within their organization, as you would see in the slide. So thank you for the opportunity. This resource has attracted a lot of interest from across the world. And if any of you would like to have a copy of the resource or find out more details, my email is on the title slide, and please feel free to get in touch with me or ask any questions that you want answered. Thank you for the opportunity.